The Zerona lipolaser is US FDA approved for circumferential inch loss. The Zerona is manufactured in the US, therefore it is approved by the US FDA government. Now the inch loss which happens with the Zerona laser is based on the diode mechanism. The lasers are something which are proved in medical history. Laser eye surgery, laser skin, laser dentistry, all kinds of laser is done, but the laser is a very proven thing in medicine. The laser which is used for the circumferential inch loss has a wavelength which is specific for the skin fat. Therefore, this is the world's first diode laser, which is an area laser. It emits 5 beams, which is one central beam and 4 collapsible beams. This can cover a huge area in a client's body surface. And if you see a person like this, a young gentleman who has weight, fat around his midsection, thighs and chest, we take standard measurements with an inch tape, like for the chest and the breastbone, the upper abdomen, the middle abdomen, the waist and the lower abdomen, along with the hips and thighs with an inch tape. So, for a client like this, we can cover as much as all the way from here to here, which is a huge area, both in the front and in the back, and also when we turn the person over, the back fat. So, this side fat also goes and this laser can work on that. If you see these beams, they have the distance between the beam and the surface of the body, we usually maintain around 6 inches. The center beam is a standard beam and these arms can be moved so that we can focus it depending on the size of the person and particular areas in which we need to focus. So, what happens is this laser beam is very specific to the skin fat. The laser will touch the skin fat and open up the fat cell. The fat cell releases the fat and becomes smaller in size. That is how the Zerona affects weight loss or inch loss in a person. So, if you see in 2 weeks, like we do alternate days 40-minute sessions for 2 weeks, and in 2 weeks you will see that 8 to 10 inches of inch loss is possible in different circumferences in the body. The beam has a circumference and it is a rotating beam, it is not a standard stationary beam. And when we work in the front, we are working on the fat here in the front as well as on the sides, because the side beams will fall on the side. After 20 minutes the person is turned on their back side, and from behind also we work on the sides as well as the back fat. So, standard session is about 40 minutes. In 40 minutes we work for 20 minutes on the front and 20 minutes on the back. After which the patient can either go and walk or run on a treadmill, or we use a power plate so that we improve the circulation in the person. Another good thing about this laser is whenever you have the laser beam falling on the person, you do not have any heat or any sensation whatsoever. So, the patient feels very comfortable. There is no drop of sweat also. There is no water loss. Whatever happens is only fat loss. If you watch this session, you see the central beam is falling exactly around the navel, and the side beams I can adjust it in such a way that it falls on the chest and it is moving, and on the sides also, this side as well as these 2 beams coming from the side. If you see, it is covering a whole area and these beams are rotating and overlapping also. So, these 2 beams will cover the lower abdomen as well as the front. The center beam will be on the front and this top beams will be on the sides as well as on the front of the chest fat. Sir, can you just put your hand here and tell me if you feel any heat?
No.
If I can keep it here, the only protection that the client needs is a laser eyeglass which we provide them. If I put my hand here or anything, you won't feel any sensation at all on the surface of your skin. So, it is very comfortable. You will not feel heat or cold or anything at all. It will look as though, it will feel as though you are just sleeping. The client can listen to music and be very comfortable with this. The only protection is, as I said, the eyeglasses. Apart from that, the session is absolutely comfortable, and you see none of the machine parts are directly touching the surface of the person. So, there is no cross infection, there is no need to clean the surface areas between everybody, and there is no risk of cross infection and things like that. Plus, no operator has to stand here once this is fixed and the beams are adjusted. The operator can move out of here, and after 20 minutes when the patient needs to turn over, that is when we redo this. Otherwise, you do not have anybody holding on any machine part to the surface of the body. The Zerona is the latest in the laser technology as far as lipolasers are concerned. The comfort level is extremely good. It's the world's first cold laser and it covers a huge area. That is the biggest advantage, because all other lasers are spot lasers and only certain spots can be worked upon. The Zerona can work on a whole area. For example, in a person like this, all the way from the chest to the lower abdomen, various circumferential loss will be there, and therefore the size reduction is tremendous in the Zerona laser.